But now I'd like to invite another perspective. I'd like to invite Zaynal to come to the podium. And to especially, I guess, we're really interested in hearing a little bit more about the community's perspective. And of course, you don't speak for all the communities. As I mentioned in the introduction, Zaynal is one of our G11. That's how we like to refer to the group of 11. They're Refugee Health Advisory Group. They come from 11 different backgrounds. But their role has been very much about building a bridge between the communities and the health system. And so whilst the family is of Somali background, it'll be really interesting to hear your perspective on it. So welcome.
Thank you. Yeah, I'm here to talk about some of the barriers that community might have with the health system here in Australia, and also what clinicians can do to help these barriers to help people to overcome these barriers. So it can be as simple as crossing the street, especially when you're fresh in Australia, like you have to look the other way because it's different, it's driving different, in different sides. But some of the things that were mentioned like earlier about the language. So the language itself, like it can be very crucial. Sometimes it can be very serious, like misinterpreting some of the simple stuff, like as doctor said, she said like 3 times daily. It might not make sense in some of the languages. And it actually happened to me. Well, not to me personally, to a family that I knew. So they were about to use one of the patients about to use a medication in the wrong way because the interpreter misinterpreted the exact way of taking the medication. And if it wasn't for me interfering and just explaining the correct way with the doctor, of course, because he was present there. So if it wasn't for interfering, there might be some serious problem with that because the patient might get overdose or something. So also I'm here to talk about some of the key points in patient-centered care, like for example, looking at the patient holistically, so the background, studying the history, not the whole history, maybe a simple and crucial parts of the history. So and getting to know the patient, getting to know the patient individually and specifically because some of the patients might have different ideas. Like, for example, patients who are fasting in Ramadan, and by the way, Ramadan Kareem to everyone. So some people who are fasting in Ramadan, for example, the doctor cannot choose an option of taking some of the medications during the fasting period because the patient's not gonna adhere to this medication. So looking at the patient specifically and choosing the right option, the right treatment option for the right patient might increase adherence and might essentially increase the trust between the patient and the doctor, which is basically why we're here for, because we're trying to build this trust between clinicians and patients. So I also am here to talk about the vaccinations as we mentioned. So explaining what vaccines are and explain not just vaccines, so explaining what the treatment is and what the problem is in a very, let's not say simplistic, let's say in a language that the patient might understand, would help the patient adhere to this medication and adhere to the doctor himself to adhere to this treatment option. So I might just mention the example with Ali. So the first time I met Ali in life skills with MDA, she was trying to explain vaccines to a group of refugees who newly came to Australia. So, and people had so many questions because people talk to each other and they heard that there are so many injections and stuff like that, like 4 injections in the first sitting with the nurses, sorry. So she was trying to explain that everything's fine, the vaccines are just here to protect you and stuff like that, but they didn't get the exact idea and they were just raising some questions. Why do we need to take 4 injections? Why is it just 1 or whatever? So I told Ali, maybe I can explain it in Arabic, in simple words. And basically, I just told him that we're giving you we're giving the body instructions on how to beat the bug if it entered. So instead of the body just getting a bug who doesn't know how to deal with, then they can actually have an instruction book, and the body can actually deal with the bug and can kill it. So something like that in Arabic. And people were like, oh, okay, why didn't you say so? So it was very easy. So yeah, talking to people and just putting them in picture and the biggest picture and just explaining what's going on, like in very very understandable language, it can help actually very much with the health system. But the thing is about the language, so choosing the interpreter is very crucial. So choosing the right interpreter who can actually connect with the family and using languages that is understandable. For example, we've had, like, not me, we've had a family like they had an interpreter, so they're Iraqi, and the interpreter was from Morocco. So Morocco basically doesn't speak the same Arabic that Iraqis do. So yeah, some of the families were having very very hard time with that because it's different dialects. So yeah, choosing the interpreter himself, yeah, it can be an issue, especially with the health system, healthcare. So also about so some of the cultures might have like certain barriers. Like for example, a female patient might choose a female doctor to talk to because it feels a bit comfortable to talking to a girl of same sex instead of just choosing another doctor. Yeah, it depends on the culture itself. So we can't just, yeah. So the last thing I'm talking about is the appointments. So I've heard a lot of people actually, a lot of issues about making appointments that take like 6 months or 1 year just to get to that appointment with the specialist. So yeah, I've heard like 2 or 3 cases where the issue either complicated, so it was a simple hernia and it complicated into a very complex hernia and needed like some stitches or stuff like that. And other cases, and it happened actually with myself. I had an issue with my eye. So until the appointment with the specialist is due, my eye was treated because it was just an allergic reaction or something like that. So I paid $200 for absolutely nothing. So yeah, so all of these issues can contribute to patient-centered care. So choosing the right interpreter, the language, explaining everything. All of these things can lead to perfect medical intervention. And that's very much everything I wanted to say actually. Yeah.
Thank you. I mean, we will have questions at the end, but if there's any questions at this point in time, I'm happy to take any questions. Any questions of Zaynal?
Any questions? Maybe I can teach you how to speak Arabic. You can spend your whole life trying to speak Arabic.
Thank you. Thank you very much. Okay, so next, I mean, there are actually in your packs. Yes? Oh, sorry. Okay, I'll just repeat that question. So the question was, how would you explain to somebody who doesn't speak English or hasn't had experience of the healthcare system here what a bug actually is?
So having people that didn't have much education in their life, it would be very difficult to explain what a bug is. But the thing is, giving a bug like a variable, like let's say giving x a value of 5, you can give a bug a value of something that can attack your body and you can't see it. Like for example, a bug that causes flu. So you don't have to explain what a bug is and what's called, like, so for example, you can't call it like Pseudomonas or Organosa. They're not gonna know what's that. But you can just explain that a bug is something that enters your body and causes disease. It's something very very simple. So all of us can understand it. Even if we don't know what a bug is, you can't say like bacteria or virus. They wouldn't know what's that. So explaining it like in very understandable words can actually contribute in the people actually adhering to the medication and the vaccines, and actually having them happy about receiving all of the vaccines and all of the medical interventions that would lead to the perfect medical intervention. Yeah. Any other questions? Yeah. Yeah.
what is the sort of support available outside the doctor, surgery, and the nurses for them to get from place A to B, or finances,
Yeah, you can
from the
repeat the question if you want. Yeah.
Okay, so the question was, when people arrive for their health assessment, they often have multiple issues, complex issues that may be outside the healthcare realm. So what other support services might be available? Which is, I mean, I'll give Zaynal an opportunity to answer that from a community's perspective, but also just to flag that that will segue nicely into our next speaker, Rose, who's actually...
I was actually going to mention her, yeah.
But maybe you might have something that you'd like to add in terms of what support systems are actually available.
Yeah, so about the support system. So as a refugee, when I came to Australia, we were all told about the free interpreting service, which is the TIS. Yeah. So, but other services, yeah, you can have an example of MDA. MDA has just received me and done most of the work for me. So, but the thing is, yeah. So basically, yeah. So yeah, Kate Cranston, man, she's wonderful. So yeah, but the thing is. When you try to like blend in Australia, there's always something like even receiving a letter in English. This can be an issue. So even maybe the people around you, they can give you some kind of support. So when you arrive in Australia, you're near here. You'll kind of like to meet with other people that are actually new here also. So some of the speaking will be going on around them. So I've heard there's like maybe a shop in there that sells free or sorry. Maybe cheap vegetables. For example, I'm just saying an example. So people just like to talk. So and also with MDA, so they try to like make some of the events that just gather people around and make us just unite and just introduce ourselves to each other and meet new people. And each family might have a new perspective that they can add to our knowledge. So instead of having just a family isolated, MDA and other organizations are trying to reunite and just try to gather the people and the families around to cover all of the things that each other some might know and some other might not. So yeah.